Okay, so we're going to go ahead and get started. This webinar will be for 1 hour, so I think it's a good idea to just start and other people will join in when they can. Hi everyone, good afternoon. My name is Beatriz Sosa-Prado, and I am the Executive Director of California Physicians Alliance. In our organization, which has been established since 1987, we educate and we advocate for a single payer system here in California. And we do a lot more work throughout the state, but I wanted to welcome you to our first webinar today. Have Dr. Steve Tarzynski, who serves on our board of directors as president, who will talk to us today. I will also be the moderator today, and our format will be the following. I will ask Dr. Tarzynski or Dr. T a few other questions that you have already submitted, and a little over halfway through this 1 hour webinar, we will have a Q&A session where you will have the opportunity to ask any type of questions that you'd like to ask Dr. T. Before we start, I'd like to go over a few things. So one, everyone is muted. By this time, you probably already noticed that your little microphone is has a little line across. Everyone is muted. But if you have a comment during Dr. T's presentation, please type it in the chat box that is to your right. We also have our chat feature. So we have our chat feature. Please introduce yourself. Put in, so what is your name, what is your organization, and what city are you joining us from? To access your chat box, you're gonna have to enable it by clicking on the chat button, which is in the lower middle part of your Zoom screen, if you have not seen that already. The third thing is that when we get to the Q&A session and you'd like to be called on, you will be unmuted by one of the staff members. And lastly, if throughout the webinar you cannot hear Dr. T or having any technical problems, please turn off your video, disable your camera, and that should reduce your bandwidth. So that way Dr. Tarzynski's video will be clear and audio should be clear. So let me go ahead and Dr. T, can you unmute yourself? I'm wondering if you are able to do that or if we could staff do that. Okay. All right, there you go. Okay, great, great. I see that you are on. Your microphone is on now. So I'd like to thank you for making the time to speak to us today. And I want to start by sharing a little bio of yourself so that everyone participating here could get to know you a little bit more. So Dr. Steve Tarzynski holds an MD and is a practicing pediatrician and president for CaPA, as I said earlier. Dr. Tarzynski has over 4 decades of activist experience in healthcare reform and in other progressive movements. He was the first American pediatrician to work in Mozambique after independence and served there during wartime conditions for 2 years, between 1982 to 1984. Dr. Tarzynski is a partner in the Southern California Permanente Medical Group, where he has practiced exclusively in CaPA's medical care program since 1984. And from 1993 to 2000, he was assistant medical director for the Kaiser Permanente West LA area. He was chief of service for pediatrics for the West LA area from 2002 to 2013, and currently serves as the West LA physician director for community relations and marketing. Dr. T is a voluntary faculty member and assistant clinical professor of pediatrics at the UCLA School of Medicine. He received his MD degree from Rush Medical College in 1977. Then he did his internship and residency in pediatrics at LA County USC Medical Center. He also holds an MPH degree from UCLA and is a board certified pediatrician and is a fellow of the American Academy of Pediatrics. Dr. T is married to Dr. Kathleen Sheldon, a highly regarded scholar whose specialty is in African women's history. And they both have grown children, one who is a pediatrician, and one is an attorney and veteran of the Marine Corps. And they also have 5 grandchildren. So Dr. T, we'd like to welcome you, and we could go ahead and get started. How are you doing today?
Good, thank you, B. Can everybody hear me? Can someone raise their hands if you can hear me? Okay, good, all right. So,
okay, good.
Yeah, I want to thank everybody for logging on. This is going to be our meeting format for a while. I get to see, snatches of people's living rooms and kitchens and studies, and even the ceiling. Sometimes people walk around with their telephones. So thank you. And this is our first go at these webinars that we're going to be doing throughout the COVID-19 crisis. We would bear with us. It's the first time we're trying it. So we will look forward to your constructive feedback on how we can improve going forward. We're hoping to do these hopefully every couple of weeks. So thanks for the introduction. We got a lot of questions from folks. So I think what we're going to do is I think I asked B to pick out 3 questions that were representative of the different types of questions we had. And so that I will try and answer them, and hopefully we can have, some more interaction.
Yeah, that's right. That's right, Dr. Tarzynski. So we can go ahead and get started. I will start by asking you to make an assessment of the current situation and the current crisis. So this is a question that we have, that people have submitted, is how is our U.S. healthcare system responding to the spread of this disease? And what does it look like for doctors and healthcare workers who are on the front line right now? I'm wondering, have you spoken to some of the practicing physicians? What are they seeing? So what does our system look like, and what is happening right now?
Okay, thank you. That's a 2-part question. So I think I have been in touch with a number of, my own department at Kaiser Permanente, West Los Angeles, and also with 2 Italian physicians who are my cousins. I'm in touch with them pretty much every day, and also a longtime friend of mine who is a physician in Spain. So I know, at least from their standpoint, how things are going there. So I think the first question was, first part of the first question is, how is the U.S. healthcare system responding to the spread of the disease? And I have some notes here, so I apologize. I'm not going to look directly at you for some of this. I would say the U.S. is responding. It's a mixed bag, and it's an evolving situation. The quote that comes to mind is Winston Churchill's quote, is that you can always trust the Americans to do the right thing after they tried everything else. And I think we're, continuing with that trajectory. For years, those of us who have been advocating for Medicare for all, for a unified system of public financing, for single payer, have, known that this has been a slow train wreck. Well, because of COVID-19, now it's just a train wreck. That's changed the whole dynamic. And I think, what we're seeing also is that the U.S. healthcare system is responding as best as it can, given 4 decades of anti-government free market ideology, which is now reaping the whirlwind. And I think we've seen a transformation from healthcare being a service to it being a commodity. And I think this is not news to anybody on this call. We know that. And I think, Phil CaPA, who was on this call, Dr. Phil CaPA from Maine, all the way in the other corner of the country, has an excellent article in the Health Affairs blog that came out earlier this week. And I would recommend that everybody read it, Phil CaPA, in Health Affairs blog, CaPER. And it's short, but very powerful. And he talks about this transformation that has happened, where we've moved from a medical ethos to a business ethos. The other aspect of it is, of course, again, no news to anybody on this call, we have probably the worst president of the United States and the worst national administration in the history of this country facing its greatest threat since the Second World War. It's a perfect storm. And we know that intelligence warnings were sent about what was going on in China in January. They were ignored. We know vital government units that dealt with pandemic, both at inside our country and globally, were hollowed out or fired. Our stockpile is been neglected, and there's no coordination or direction given, with the exception of Drs. Fauci and Birx, and who I think are having to tiptoe and do a very careful dance around this president, which only adds more problems for us. I think in terms of a mixed bag, the response varies. Different states, different counties, different cities are managing in different ways. And if you have states and cities and counties that tend to be skeptical about science and skeptical about government and hostile towards these things, then you're going to have a response that's going to be more damaging to the people living there, and also could possibly impact other counties, cities, and states that are doing more and faster to block this. Again, also, I think this is not going to take over the whole country all at once. We're going to see a wave of this coming through. We already see that, which in some ways, it's bad for those who are hit first, like New York City or Seattle, but it can buy time for other places and also permit us, if we get it together, and it seems like it is happening now, to shift resources, people, doctors, nurses, respiratory therapists, ventilators, other resources around the country where they're needed. So we're going to see an unprecedented level of coordination that hopefully will come out of this as one of our learnings. There's also treatments that are being looked at. I don't think the situation is hopeless. Everybody knows, again, on this about chloroquine, about remdesivir, and other protease inhibitors and HIV medications. And there's also interleukin-6 or IL-6 inhibitors like tocilizumab that were being studied that look promising. But we're going to have to, science takes time, and we're going to hopefully find out sooner rather than later if these treatments are as effective as they seem to be. And I think probably most heartening in a way is that, there is a frantic, massive, coordinated global effort, both in terms of government and private sector, the greatest in history to find a vaccine and treatments. And I think that is very hopeful in that sense, even though we have all the other issues and obstacles that we know of. Second part of the question is, what does it look like for doctors and healthcare workers on the front line right now? Probably catastrophic, dangerous, overburdened for many people, and quiet, nervous waiting for other places where the surge hasn't happened. I know what's going on there. Again, my own experience in Mozambique in the 1980s, where there was a war zone. We had very little resources, hundreds of people dying. You felt like nobody was coming to save you. You had to rely on each other. And healthcare workers themselves were vulnerable to malaria, other diseases, South African mortar fire, artillery, airstrikes. So, I feel for those people, and I remember what it's like. And they're all young physicians. I was 30 years old when I landed in Mozambique for the 2 years I worked there. So I feel for those people, and I know what they're going through. And so in terms of what it's like, it's difficult to know unless you've been in it yourself. And I think a lot of people will be. But there also lies hope there, I think, because people will and are learning to share resources. They're learning to work together. They're supporting each other. And I think this will be an experience that will mark them professionally and personally for the rest of their lives, sometimes in negative ways, but also in positive ways. So what's going to come out from that, we're going to see.
Mm-hmm. Thank you for that answer. Yes. Some of us, for instance, I don't have a healthcare background, so I personally wonder what's going on. And it's good to hear it from a physician. It's just good to hear your answers. So now we're going to move on to a couple of other questions about where are we going? What happens? After this crisis? What will happen? So the first question, or the second question I have is, so CaPA, California Physicians Alliance, believes that a single payer system or Medicare for all is urgently needed in the United States to best meet the needs of patients. Can you tell us how such a system addresses would address this national pandemic or global pandemic and medical emergencies?
Sure. I think, first of all, I think about my Italian grandmother who used to say, in front of nature, man is nothing. So pandemics will continue to occur. And whether or not, no matter what kind of healthcare system we have. So the question is, how are we prepared for that? And how can we mitigate the impact of that, both as a nation and as a planet? I think probably out of all this, hopefully we'll see more international cooperation, not only on healthcare and pandemics, but perhaps also climate change and that the issue also, which is also another type of pandemic. And I think, obviously under single payer systems, how could such a system better address a national pandemic and similar medical emergencies? I think, obviously, first of all, you look at the ethics, as we pointed out, where healthcare would not be a commodity, it would be a service. It would be a public good. And there would be an ethos to guide that system that is different than the ethos we have now. And obviously, with that type of system, we would have stronger infrastructure at all levels, resources would be available, and we would have public health as a priority. And also coordination, not only, as I mentioned, among within our country, but also with other nations at a greater level, and cooperation. I think also another issue that we're seeing now are the disparities that we have in our healthcare system and how they're impacting different people depending on your zip code or your race or your gender or your income level. Many ways, many of the things that make us a diverse people. I think, under a single payer system that we would have fewer disparities. And so when these pandemics hit, I think obviously we would hope to eliminate the disparities, but we certainly would be going a long way to mitigate them and eliminate them. And I think that that type of impact, unequal impact, we would not see. And the great amount of suffering would be avoided. And the other thing that we would avoid, I think, is the economic ruin that we're seeing now, both at the individual, family, and even business level and national level. Because as we all know, again, I'm speaking to the choir here, we know that all people already have been suffering bankruptcies. Most Americans don't even have $400 in the bank to deal with emergencies. One can only imagine what's going on now. And the economic ruin that we're going to see coming out of this, the horror stories are just going to pile up. As I said, the slow train wreck has turned into a train wreck. Under a single payer system or a unified system of public financing with a medical ethos and a service ethic where it's not a commodity, I think we would see a much lower level of economic ruin than we are seeing now. Again, we are reaping the whirlwind after 4 decades of free market anti-government ideology.
Mm-hmm. All right. Okay. Another question that we have is, what are CaPA's organizational plans to advocate for a major healthcare reform during and after this crisis? So what will happen? What do you think will happen after this crisis? Will our organization, and we've had these conversations already, being me being the executive director and you being as president of the board, but for people who have questions, people want to know if If and how will we work with the Healthy California for All Commission? Will we work with the governor? And how do we plan to work with legislators?
Well, I think like everyone else on this call, we're not going to, well, maybe we hid in the corner under a blanket for a few minutes, but we're not going to stay hidden in the corner under a blanket. I think we're going to, take steps. All people are oriented to fixing problem. We're problem fixers, problem solvers. We want to do good. We chose a path of righteousness long ago in our lives to lead us in that way. So we're not going to give up. And I think that obviously CaPA is continuing the range of work that we do with a few more obstacles. We can't get together in person to talk, all of those kind of things. Movement is restricted, a range of things like that. And also I think as a nonprofit, CaPA also will be, at greater risk, as all nonprofits are going to be, in the coming period. And so we're going to have to learn how to navigate those even more treacherous waters in terms of funding and resources. We're all learning how to work from home, what I call under house arrest. That's something new. And I think human beings are pretty resilient, and people who work on healthcare reform are pretty resilient. People who take care of patients are pretty resilient. So we're going to find some workarounds. Our advocacy work is continuing. We are still, engaging with legislative work. That's still going. I think it's starting to pick up again. Bills are being written. Things are being done. These issues are not going to go away, covering the rest of the undocumented in California, making healthcare more affordable here, and generally moving towards a unified system of public financing. So our advocacy work in the legislative field continues. And we are in the process of rolling out what we're calling an ambassador program. And I see Bernie Nadel on the call, who's Farouz, who's moderating this call. They are our lead people on our ambassador programs, where we will train speakers to go out into the community to give a consistent and coherent perspective for CaPA and how to move forward. We still have our roadmap that we developed we think is really important on how to go about getting to an actual single payer system in California. The details are important, but more important is the framework and the concepts in it. And I think that's valuable. No one else has done this but CaPA to the level of detail. We're proud of that, but we're also irritated by that because we wish other people will be doing it as well. But I think the concepts and the frameworks provide a good template for legislators and for advocacy groups and our allies. Finally, our coalition work.
I wanted to backtrack a little bit because you mentioned the roadmap. We have some people that have joined today that have not heard probably about what the roadmap is. Like, what are you talking about? Can you explain what it is?
Yeah, I will in just a moment. And the fifth thing that we're working on is our continuing our coalition work with coalitions that we work with on a range of healthcare issues. Not all of it single payer. Many coalitions are working on immediate issues related to disparities, emergency issues, vital life or death issues that we work with them on and provide the support of a progressive physicians organization that helps them and provides the value that an organization with our reputation can give to their work. And in doing so, we build our own coalition for single payer going forward. With respect to the roadmap is a document that three of us wrote, and I see Hillary Siebens is on the call as well. She's one of our three co-authors. I'm not sure if Angelica Ramirez is. We wrote this about a year ago, maybe 9 months ago, and what we wanted to do was figure out how exactly do we get from where we are now in California to a single payer system. How are we actually going to do that? How does it happen? It's not going to happen overnight. We realized it needed to happen in phases. We could think of three. There were important key strategic policy areas that needed to be worked on. We thought of 5, maybe others will think of 6 or 7. possibly more. And we realized it had to be both legislative and non-legislative changes. So we crafted this. It's a 21-page document. You're welcome to go to our website. We also have a one-page summary, for a more merciful summary of the document. And we encourage people to look at that. And again, you know, that was written a year ago. In some ways, the situation has changed. Many things here in California are already being implemented by our governor and our legislature. But I think we needed to have we wanted to have a coordinated approach to this, not just throwing 100 different bills, 100 different efforts without any coordination. How do we do this in an organized, stepwise fashion that is measurable so we know that we're heading in the right direction? And we're very cognizant that there needs to be changes at the national level as well, in terms of, in terms of ERISA, acts of Congress and waivers. We know that, but there are lots of things that California and other states can be doing in the meantime that will help improve the lives of people, but also moving forward and changing the rules of the game as we go along. And, getting a managed decline of the private insurance industry, similar to a managed decline of the fossil fuel industry that we need, and moving forward and enhancing, strengthening our public systems, and building the kind of resources that we need to move to single payer.
Yes. Thank you.
I think there was one question also about what comes after the crisis. I don't know. I have my crystal ball in the garage, and I haven't looked at it lately. But I can only speculate. I'm sure everybody here has ideas. I think we're already seeing, and what I expect there to be would be not a surge of the virus, but a surge of anger and a surge of advocacy in the healthcare sector like we've never seen before. You're already seeing nurses just asking for protective equipment. And I think a lot of the seeds that the single payer movement and those of us who's advocated for health reform have planted over the decades will now begin to flower as people see the terrible shortcomings of our system. And it's important that we're going to be able to productively channel this anger in ways that will build positively. And we need to be aware that there are going to be competing narratives. All right. The other side isn't going to roll over and die. They're going to be fighting to put their narrative and their explanation of what we need to do and how we need to fix this. So the fight is going to continue. I think we've gotten a big boost just from reality, and it's at a terrible, terrible price. But I think, going forward, that's just my own very vague, rough, semi-ignorant assessment of what's going on. And the final part of that question was, will we work with the Healthy California for All Commission, governor, and legislators? Of course we will. We're anxious to get back. We were invited to testify to the legislature, so we could, and we worked hard to get to that point. We worked hard to develop our roadmap. So we will absolutely continue to engage with the commission and the governor and the legislators.
Great. Thank you. So joining us on the call today, there are several people that are advocates and leaders in many ways. And there are different levels of involvement. Some people have contributed a lot via donations, volunteer work, just advocating, and some people that might be new to the movement. And so I'm wondering, Dr. T, what are some ways that as advocates we can advocate for single payer Medicare for all right now in the midst of this crisis?
Well, there are a number of things. Obviously, we are still connected, and possibly even more than ever, due to technology. And I don't know about you, but I've been getting a flood of emails and Facebook posts and messenger messages and WhatsApp messages, and I didn't realize I was so connected. So there's plenty of opportunity. There's almost too much to get involved. And so I would say, people need to focus, pick one or two things so we don't burn out, and engage in meetings, engage in advocacy and lobbying as much as we can, given our constraints until the physical distancing is lifted in certain areas of the country. I don't think it'll happen all at once. And certainly support for CaPA and the work that we do, both in terms of your volunteer time, because We can certainly use more volunteers. There's a lot of work to be done, and also your financial support as well, because as I said, nonprofits are all going to be are already in a precarious position. So we and you can contribute through CaPA, not to CaPA, but through CaPA, you can contribute to making this a better healthcare system. And again, you're already probably engaged with other things as well, but I would just recommend it. Be careful about being overwhelmed.
Yeah, thank you. And so now as we transition, your last comment, it's a great segue to transition to our Q&A session. But can you, as a physician, can you give us some recommendations? What do we do to take care of ourselves right now and to take care of those around us, our loved ones, whether they live with us at home or they're elsewhere?
Well, number one, be kind. Be kind to yourself and be kind to everyone you live with. They're going through the same thing. And I think, obviously try and get some daylight. We know that sunlight is helpful for depression and mood. Yeah. Eat healthy, trying to get some sleep, read books, try and divert yourself. All of this diversion and rest is important. In addition to the important advocacy work that you probably all are doing or studying or delivering healthcare, many of our folks on this call now are also taking care of patients, either in the middle of the surge or soon to be. So I think all of those things are important, and relying on each other as best as possible. And I think I was going to say this at the end of my talk, but I can say it now as well. I think in a lot of ways, everyone on this call is a leader, perhaps formal leader and informal leader. We are in many ways responsible for other people, not just ourselves. And I think, there are three things that leaders are going to have to do in this coming period, and all of us. That is, number one is to absorb the chaos. Number two, project calm. And number three, give hope.
That's great. Thank you. Okay, so now we can go ahead and move over to our Q&A session. If you have any questions, please open up your chat box and type it in there, and we will go ahead and ask any questions that we receive. Okay, so one question is, what are the top 3 barriers to making Medicare for All a reality in the United States? And I guess the second part to that would be, what are these barriers? Do you think that these barriers would be different to making Medicare for All a reality in California?
Well, I think number one is obviously the interests aligned against it. The business interests, not all business interests, because I think many businesses would favor and benefit from a unified system of public financing, and we know that. But I think the medical industrial complex, shareholders, private equity firms, things like that, they are a major obstacle, and they're very powerful. The insurance industry, pharmaceutical, pharma. They are obviously, we know this, nobody on this call doesn't know this, they are, an obstacle. Second obstacle are their, so-called representatives in our legislatures at all levels, both the, state, local, and national. So that, means the realm of politics. So that's also a problem. That's a barrier. And I think the third is a feeling of despair and cynicism, that is, even more, that we are even more at risk now, which is a result of the 4 decades of anti-government free market ideology that, has spurned a lot of cynicism against us being able to do things, against the, people's faith in the American government, in a way, skepticism and irony are hallmarks of contemporary, modern thinking. So we need to be aware of that. and how that impacts our ability to do things. So some of it is, that. So I would say those are probably the top three.
I see. Thank you. We have a question from Karina Mayer. What do you think needs to happen from here on out in addressing the COVID crisis to the right of the ship?
To right the ship?
To right the ship, I'm sorry.
Okay. Hi, Karina. What things, could you repeat the question again?
Yes.
What needs to be done now?
What exactly from here on out in addressing this crisis to right the ship?
Well, I think, again, there are probably people on this call more qualified to answer that than I am, but just from my perspective, I think greater coordination at the federal level. Hopefully the pressure for that will come. Again, Churchill's quote, you can always trust the Americans to do the right thing after they've tried everything else. Hopefully we're further along that arc than we were. And I think we have to hopefully rely on the states and I think continue with physical distancing until that happens.
Mm-hmm.
And of course, continue to advocate for change. I mean, this is an opportunity for us really to jump in there. And I know people are stressed out. We're tired. We're worried. We have, to do a lot of things that we don't usually have to do. I mean, we went shopping this morning and it took me half an hour to wipe everything down and sort it out on the counter. Things that normally take a couple of minutes take a half an hour, 45 minutes. So we have a lot of other things that we're doing, but don't lose track of staying on task.
Thank you. I would like to open it up for any comments that our participants have. You can raise your hand or put a comment in the chat box and we will make sure that your microphone is working. Do you have any comments or any questions that you'd like to make at this time?
I'm sure getting a lot of questions in here. I can't possibly answer them all. They're all good.
Okay, we have a question from Christina Acosta. What do healthcare workers need most at this time in order to meet the needs of their patients and their own safety?
Oh, again, I'm not an expert on this. I only have my own experience as a healthcare worker. The most important thing now is safety equipment. Decent masks, gowns, personal protective equipment, PPE. They need, more staff to relieve them because people are exhausted. So hopefully the interstate coordination. I know California started a California Health Corps that's going to go to other states and support them if needed. Obviously, so equipment, personal protection, and people to relieve you, more personnel to avoid burnout. And I think, just the other things that we need, make sure there's enough oxygen, enough ventilators, enough hospital beds. And again, those are things that healthcare workers themselves can't fix. This is up to administrators and political leaders. That's what people need right now to do they just want to be able to do their job.
Okay. We have two questions from people, and I'm wondering if staff can enable their microphones so that they can ask them. The first person to ask the question that we should call on is Shiva Umesh from UC Merced.
Hi. My question is more about regarding the COVID-19, that whole outbreak. I was wondering if as a physician, if you know of any promising treatment options to help those who are affected by the disease, and if you know anything about the use of antibodies from those who had the disease and to help those who are currently affected by COVID-19.
Right. Again, I'm not an expert on this. I am a clinician, and then I've been learning as well in my talking to people, from Italy. There are some promising treatments, but again, these things take time to make sure that they work and that they don't cause harm. As I mentioned, there's a drug called tocilizumab. The brand name, I think there's several brand names because they're made by different companies, and it's an interleukin-6 inhibitor that should help block the inflammatory pathway and the attachment of the virus onto the ACE2 receptor on the pulmonary, on the alveolar cells of the alveolar lining. But it has to be used early before there's a lot of damage done. There's the remdesivir, which was a drug used for Ebola, protease inhibitor, and the other people are looking at these similar classes of drugs. Not sure yet about chloroquine. I'm waiting to hear what Anthony Fauci has to say. He's the expert. I certainly ate a lot of it when I was in Mozambique, that's for sure. So I'm not sure there's any of it left in my system, but that looks promising. And in terms of antibodies, that's possible. I mean, the issue is, the question, if you're using products that are made from humans, there's always the potential for allergic reaction or another immune reaction. So that's a risk. And so if there's the way that those antibodies can be mapped and produced by recombinant DNA technology, so you remove that risk, that's a possibility as well. But again, that's way beyond my pay grade.
Thank you.
That's just my peasant level understanding.
Appreciate it. Thank you.
Yeah.
Thank you, doctor.
We also had Phyllis Chastain raising her hand to ask a question. Can we enable her microphone? I believe she can ask now. Hi, Phyllis.
I advocate and work with the UCLA School of Public Health, and I'm a PhD student. We had a water main break in the city of Carson and a boil water alert. That means that we have to boil the water or use bottled water, and we were referred to the CDC website. The question is, do you know of any evidence of COVID possibly being in drinking water? I searched the CDC website and I spoke with my primary care physician. So I'd just like your opinion or any other information to feel more comfortable.
I don't know, and I haven't, this is the first I've heard of it, so I haven't had a chance to, check the CDC website. I mean, the coronavirus is very deadly, but it's also very vulnerable because it has what's called a lipid envelope. So it's hard for it to live outside of a human being. So, I don't know. That's really very unfortunate. It reminds me when I was in Mozambique, enemy forces blew up the power line, the water line into the city. And we had a cholera epidemic, and we didn't even have any gloves then. So we were trying to take care of cholera patients without gloves and no water. So I can appreciate what you're going through. But in terms of a professional answer, I don't know. Probably you get more out of the CDC and your doctor than you will from me.
Thank you. I was a Foreign Service officer assigned to West Africa, and I worked on the Middle East and East Africa desk. So I'm getting flashbacks of schistosomiasis and other waterborne illnesses that have occurred in certain settings. But my physician could not even answer the question. So again, at least your answer is consistent. I don't know.
The other possibility was you might check with folks at the UCLA, at the public health school, UCLA. Hopefully someone there will know.
Thank you very much. I appreciate it.
Yeah.
We have one question from Brett Polish in LA. So Dr. T, what things do you think ordinary people outside the medical field are ordinary, but people in the medical field are extraordinary? What do ordinary people need to do to get in order to stay safe and healthy at this moment? In addition to the things that you mentioned, be kind and take care of ourselves, get some sunshine.
I think physical distancing is the most important thing we can do. I don't call it social distancing because in a lot of ways we're more social now than ever. I've had all kinds of social interactions, probably more than ever, using technology and so it's not social, it's physical distancing. I think you have to be rigorous and adhere to that and follow the instructions of the local public health authorities to the letter. It's going to be tough, but it actually will help shorten it. And I think that right now the recommendation is coming out that we should wear masks when we go into public places. I think if you're taking a walk and there's nobody around you for 100 feet, I don't think you need to wear a mask. But I think if you're going to the store or riding in a car with someone else who's not from your household, I think masks make a lot of sense. I don't think they need to be N95 or medical grade masks. Those should be saved for healthcare workers. But the other cloth masks that will be coming out, I think will be important. And of course, washing your hands, for those of us in healthcare, a lot of this is not new. We've been washing our hands and dealing with masks and protective clothing and gloves for decades. So it's not weird, but for most people it's new. So I think, washing your hands, physical distancing, being careful when you're bringing things in the house, mindful of that. And if you're feeling sick, and check with your doctor, about whether or not you should get tested or not.
Mm-hmm. Do you recommend or what do you think? What is your stance on homemade masks?
Homemade?
Masks.
Oh, mask, okay.
Mask, yes.
Something is better than nothing, I would think. But again, it's difficult. You can't monitor the quality of these masks, and the virus is a very tiny particle. And the fibers on a mask, to a virus, it's like going through the, goalposts, in between goalposts, so it's a very big opening for a virus. So it's hard to know. But again, some barrier is better than no barrier. I don't think you have to wear it in a house, but I think at some point more masks will be coming out, and we'll follow. Again, I would follow the instructions of the public health authorities. But if you have zero masks and you're going out, I think something covering your face is better than nothing. Again, you don't need to do it if you're going for a walk, and there's nobody around you. But again, if you're going to go shopping to the grocery store or pharmacy, yes, you should cover.
Mm-hmm. Okay, I'm wondering if anybody else on the call has any questions or comments. We'd love to hear what's on your mind right now, or what is something that you learned about this, the spread of this disease, in the last few days. If you have any comments, please let us know. I believe someone's ready to speak. Mike?
Well, this is Phyllis.
Oh, Phyllis, yes.
I've found the exponential increase in COVID-19.
Phyllis, we're getting an echo from you. So.
Yeah.
Oh, okay.
Maybe mute.
So I learned that how rapidly the disease has spread, and the projections of 100 to 200,000 victims is a huge learning issue for me.
I just realized that I was muted. Yes. So is there anyone else who would like to share a story about what they are currently seeing on the front line, or that you are experiencing at home? This is a space where you can just talk about what you're experiencing. We'd love to hear from you. Okay, if you do have something to share, please type in the chat box or raise your hand. Oh, Philip raised his hand, but we have a question that we will read from Kevin Liu first, and then we will ask Philip. So, Kevin Liu's question is, what is one reliable resource you go to for updates on the pandemic? Personally, I have been following Dr. Holt and his YouTube channel, and Kevin linked it on there. So what are some of the resources, reliable resources that you visit, Dr. T?
I look at the CDC website, and I look at the Los Angeles County Department of Public Health. every day. And of course, twice a week I have somebody's got a very angry dog. Twice a week I have my conference call with my department and my medical center. So those are the ones that I look at. And then I think the University of Washington also has a pretty good website. And it's the acronym is EHMI. I think it's the Health Metrics Institute for Health Metrics and Evaluation, IHME, Institute for Health Metrics and Evaluation. Their website from the University of Washington is very helpful as well. And you can go there as a drop-down menu for every different states, every state in the country, and especially California, give you an idea of what the shifting situation is with relative to the number of cases, how flat the curve is, the number of ICU demand, the number of ICU beds, the total number of beds, and so forth. That's a very helpful and dynamic website. University of Washington Institute for Health Metrics and Evaluation.
Dr. Hillary Stevens from Long Beach mentioned that the New York Times has a free COVID-19 information on how to cope and et cetera, and that is free, and you don't need a subscription. So that's good to hear, to know. So the New York Times. And we had Dr. Caper, Dr. Bob Vanetz, and Dr. Jim Kratzer who wanted to ask some questions, as well as Kevin. I think, Kevin, you already asked your question. We asked your question. But Dr. Caper, you could go ahead and speak.
Yeah, thank you very much. And Steve, that was a great job you did. But I want to emphasize the point you made, and which is why we wrote the essay that was in Health Affairs. And that's the corporate takeover of American medicine, which has occurred over the last 40 years, beginning in 1980. I have been advocating for single payer since I worked for Senator Ted Kennedy in the early 70s, which was the last time we had a real single payer bill before the Congress. And this fight is not about persuasion. Persuasion is important, but only because it facilitates power. This is about power. And the problem we have is that we have two huge stakeholders in our healthcare system that are working at odds to one another. One of the sets of stakeholders are the caregivers, doctors, nurses, and people who think the healthcare system should be for diagnosing, treating, and healing illness. In other words, putting patients first. The other group of powerful shareholders are the corporate people, whose fundamental mission is to make as much money for their shareholders as possible. I'm not criticizing them because it's not that they're doing something they shouldn't be doing. They're doing exactly what they're created to do, and that's create wealth for their owners. They're just doing too much of it. And they're doing too much of it because we let them do it. The power we have is the power of the voter. Politicians,
Go ahead,
politicians can only get so far ahead of their constituents before they're out of a job. So it's our job to persuade their constituents. We've done a good job so far. I think the public is with us, but we have trouble getting attention from the press and from the public. This virus has given us, as horrible as it is, it's going to be a shot in the arm to our movement, because everybody now is watching the healthcare system be laid open with all of its defects in a way they can't understand. And it's a time, I've never seen a time in my 50 years of advocacy that is more propitious for bringing about fundamental change in our healthcare system than I do now. And I would urge all of you to learn about this and to understand that we have to return the mission of the healthcare system to putting the patient first, period. It's very simple. And we have to demonstrate to the American people that the mission of publicly traded companies which is determined by what Wall Street tells them it is, and now increasingly hedge funds, that has to be defeated. We have to get rid of the corporate culture that has increasingly infused medicine for the past 40 years. That's a heavy lift. It's a $3 trillion industry, but I think the public would support us if we can, as healthcare professionals, make the case for that.
Thank you, Dr. Keeper. We have time for a 1-minute question or comment. I know that Vanessa, Bob, and Carl wanted to ask something or make a comment, so please feel free to take the mic.
Hi, this is Vanessa. I asked the question how the roadmap would be equitable to those who are undocumented who work without an SSN or an ITIN number. What are the steps that we're taking in legislation to support the universality of health coverage?
Well, as you may know, CaPA was instrumental in getting undocumented children covered under Medi-Cal, and we also are working to get the seniors covered, and also we help get the younger workers covered. So we fully support that, and in the roadmap, we include everyone who lives and works in California, regardless of immigration status.
And we have time for one more comment.
Real quick.
Yes.
First of all, I want to express appreciation to Phil. He's been a great ally of CaPA's for a long, long time, PNHP and in other ways. We need to make sure that we use this crisis to the maximum. and that's not meant cynically. Already the Vice President of the United States has stated that the insurance companies are going to waive out-of-pocket costs for patients, and that patients who have no insurance are not going to have any cost for getting treated for COVID-19. So we have another incremental step towards universality here. Now, it's done only for one specific diagnosis, but the notion that everybody should be able to get treatment without regard to their insurance or financial status is important along the way to everybody getting treatment for everything and not just some things.
Thank you, Dr. Kratzer. So it's already 4 o'clock. And so we have to end this webinar so that you can go on with your day. So CaPA supporters and healthcare justice advocates, I thank you for your participation today. You all had wonderful questions. Thank you for your contributions. We really look forward to continuing this dialogue with you in our future virtual engagements. Please be on the lookout for that. We already have a calendar and some topics that we'd love to address through these engagements. You will hear from us. We will share that information via email through our blasts. And in the future, we plan to have webinars such as this one, community dialogues, and office hours where you can join and talk with CaPA staff, ask us some questions, tell us your stories, and just get to know us a little better. And it'll be a great opportunity for staff to get to know you as well. So thank you again so much. Please share the information that you learned today with your friends, your colleagues, your family members. Put it all over social media. We'll work on creating a hashtag for these CaPA live engagements. And if you have any ideas for a hashtag, something creative, and you'd like to just suggest those to us, we're more than open to receiving that. Please stay connected, continue to stay healthy and well, and take very good care of yourself and your loved ones.
Thank you.
Good afternoon, everyone.
Thanks, everyone.
Thank you.
Bye.
Bye-bye.
Great session.